Polycystic Ovarian Syndrome, also known as PCOS, is a hormonal disorder that affects about 5 to 10% of women of childbearing age. And this condition is usually characterized by hormonal imbalance. There's presence of cysts in the ovaries. There could also be other ovulatory problems as well as irregular menstrual cycle. Now, it's important for us to have an understanding of this condition so that we can help improve diagnosis, reduce the stigma associated with it, also ensure that effective treatment is being carried out, and also improve the quality of life of the woman. That is exactly what this video is designed for. Hi beautiful people, welcome back to the channel. For some for the first time, you're welcome. My name is Isholona and I am a registered nurse, a registered midwife, as well as a professional makeup artist. And over here we discuss everything pertaining to faith, health, nursing, as well as beauty. So if these are the kind of contents you're looking out for, please do not hesitate to like, to share, as well as subscribe to the channel. The title on your screen, you know that we're going to be looking at Polycystic Ovarian Syndrome. Now, what exactly is Polycystic Ovarian Syndrome, or PCOS? Now, PCOS is simply a cluster of symptoms that occur as a result of hormonal imbalance, and this hormonal imbalance is due to the presence of fluid-filled cysts present in the ovaries of the woman. That is, the ovaries present in the uterus of the woman. Now let's look at the symptoms. Now, what are the symptoms of this condition? Like I said, this condition has an array of symptoms, but I would like to divide the symptoms into the fertility associated symptoms as well as the physical symptoms. Now, for the physical symptoms, we have presence of acne, presence of dark patches on the skin. There's usually skin tags found on the skin. There's increased production of hair on the body, so we have increased hair production found on the chest area and sometimes the back area. There could also be weight gain as well as thinning of the hair. For the fertility associated symptoms, we have missed periods. Sometimes there is light period or irregular period. There could also be presence of cysts in the ovaries as well as infertility. Now let's look at the cause of PCOS. I said that PCOS is as a result of hormonal imbalance, and for PCOS, the hormone that comes to play is the androgen, which we call the male hormone. We call it male hormone because it is found in abundance in male, and it is responsible for those signs of puberty you have in the males, which include excess hair production and all of that. Now, you also find androgen hormone in the women, but in small quantities, right? And this is also normal. But for some reason, certain factors trigger the excessive production of this hormone androgen in the women, which goes on to cause the condition PCOS. Now, factors such as insulin resistance is one thing that contributes to the excess production of androgen in the body. What do I mean by that? Insulin is a hormone produced by the pancreas of the body, and what it does is that it ensures that the sugar and glucose gotten from our food is being adequately utilized by the cells to carry out the body function. Sometimes this insulin the body is resistant to this insulin, causing sugar and or glucose to be excess in the bloodstream. Now, the body's mechanism of counteracting this is to ensure that more insulin is being produced. And once there's excess production of insulin, it therefore means that there's going to be excessive insulin present in the body. This triggers increased production of androgen hormone. Do you get the mechanism? Now, androgen hormone, once present in excess in the body, will now go on to affect ovulation. And by ovulation, I mean production or release rather of eggs from the ovary. Now, other factors include genetical factors, environmental factors, as well as hormonal imbalance. Look at the complications of this condition. You can easily deduce the complications based off the symptoms I talked about. We have gestational diabetes, which is simply presence of diabetes in a woman who is pregnant. There's also pregnancy-induced hypertension. There could also be miscarriage as well as premature birth. Sometimes you also have diabetes, that's especially the type 2 diabetes, and the most common complication we have is obesity as well as infertility. The diagnosis of this condition simply involves the use of blood tests as well as ultrasound scan. Now let's look at the treatment modalities we have for this condition. When it comes to this condition, the treatment varies from woman to woman because certain factors have to be put into consideration before a particular treatment is decided on. Now, for a woman who intends having kids in future, then that woman is being placed on medications that will help to trigger ovulation because this condition affects ovulation, and once ovulation is affected, there's high chances of having infertility problem. So she's going to be placed on medications that will trigger ovulation. She's also ensures that she involves herself in lifestyle modifications, which include eating healthy, exercising, or ensuring that she carries out some form of physical activity so as to ensure that her body makes use of the excess insulin in the body, and this will go on to ensuring that the androgen that is produced in excess is being reduced, right? And remember that it's androgen that is responsible majorly for this condition. That's excess androgen production in the body. Now, for a woman who doesn't want to get pregnant in future, she can be started up on diabetic medications that is going to help her, especially combat the insulin issues that she's having. She could also be placed on birth control pill. Remember, I said the treatment depends on certain factors. Now, she can be placed on birth control pills, and the essence of these birth control pills is to counteract the effect of this condition, that is the symptoms, which includes menstrual cycle issues, acne issues. This birth control pill will help her reduce those symptoms to the barest minimum. Now, I want you to note something that having said all this, the woman also have to ensure that despite the fact that she doesn't want to have more kids, she also have to be active physically and also engage in eating healthy. Note, this condition, PCOS, doesn't have a cure for now. As of today that I'm speaking, it doesn't have a cure, and that is why every treatment that is made available is geared towards the symptoms and not curing. Look at, if you listen to all the treatment I talked about, they are after the symptom, this symptom, this symptom, this symptom, not actually curing the condition. I hope you understand. Now, with that, I've come to the end of this video. I hope I've been able to explain in details everything you need to know about PCOS, definition, the causes, the symptoms, the complications, the diagnosis, as well as treatment. If you have any questions, please let me know in the comment section below. If you have any recommendation, let me know in the comment section below. And until I see you next time, please don't forget to subscribe to the channel, like, as well as share. Bye, love, please, and God bless you.